All right, guys, thank you for joining. So this is our medical professional roundtable Q&A, revolving around all questions about COVID-19. I'm Nicole Bosco with Nona Hood News, and in the Nona, I will be the host for the roundtable. And today we are joined by Dr. Will Felix and Dr. Sumit Bhavsar. And Dr. Felix, you are an emergency and sports medicine physician. And Dr. Bhavsar, we have you as an internal medicine and hospital medicine, correct?
That's correct, yep.
Thank you so much for joining us today, guys.
Well, thank you for having us.
So let's jump right in. So we had a few questions submitted to us by some users previously. And it was, one of our questions is, do we need to take extra steps? Dr. Bhavsar, can you hear me?
I can hear you, but I don't know what's going on with the wall. I think maybe it needs to disconnect or reconnect.
Dr. Felix?
I'm gonna do that.
Okay. So we'll continue. So it's, do we need to take extra steps with grocery deliveries if anyone in the house has medical issues? And that question came in by Shelly Denise.
Okay, this has been a topic on everybody's minds, I feel. Yeah, definitely we need to take a few extra precautions. When you get delivered, it's a little bit safer than going to a grocery store by yourself, obviously. Now, when you get delivered packages, I would advise that when you're picking them up, maybe you can use some gloves to pick them up, take them inside the house, take them in a clean area where you can actually desanitize whatever packages you have. You can use one of these Lysol wipes or any other types of wipes that you have that have alcohol in them or bleach in them, kind of desanitize the products. This is just a safety precaution because you know that the virus can survive in surfaces for anywhere 24 to 48 hours. So if you just desanitize these products this way before you actually put them in your fridge or before you actually open them, I think that's the way to do it.
Dr. Felix, can you hear me now?
I can hear you well.
Fantastic. So do you have anything to add to the question? It was, do we need to take any extra steps with deliveries if anyone in the house has medical issues?
The part that I was able to hear from the doc here, I mean, he's right on target. I would have said the same thing.
Okay, fantastic. So the next one is, how much has this crisis taken away from your personal family time? And that was submitted by Logan Rose. So Dr. Felix, how about you start first?
It's taking a toll. And the thing that comforts me is that I'm not alone. There's a team of healthcare providers. There's a team of people out there who are committed to our community, committed to service, that are going through the same ordeal. So I recently got tested because I was exposed. I was quarantined for almost 5 days until we got the results, and thankfully that was negative. But even in that sense, I still come home and I don't hug my kids. I don't kiss my kids. I don't kiss my wife. I'm in my own dormitory just because I don't want to expose them, even though I just tested negative. But as early as tomorrow, I'm going back to the emergency department. And so it is what it is. I mean, it's better for them to have a healthy dad. It's better for my family to be healthy and not be contaminated if I take the necessary precautions. So it's just a price to pay.
Dr. Bhavsar?
This is one of those touchy questions. I think what Will is saying, it's exactly right. You have a lot of anxiety when you're going into work. Number one, you're leaving your family at home because of the circumstances. You know what you're going to encounter at work, the kind of situations. You know exactly what kind of patients you're going to be seeing. And then when you leave work as well, you don't want to bring anything home because you don't want to endanger your family. So you're at work with your scrubs on. You're trying to you're trying to do your best by desanitizing at work before you even step in your car. Before you get out of your car at home, you're trying to like desanitize again. And then when you get home, you're being very careful with your shoes, with any other, with your watch or anything else that you have on you, and you make sure you leave that outside in the garage before you even walk in. Because I think there's a lot of anxiety, a lot of, we're all feeling it throughout the medical community because we're in this high risk environment. And we could get sick. I mean, we're physicians, and we were. I guess we signed up for this. We signed a note for this. But to endanger our own families, it's something that crosses our mind every day. Every day I go to work, I think about this. I think, okay, am I going to bring something home? Is someone going to get sick because of me? It's tough. Should I just not go to work? Should I just call in sick? It's not the right thing to do. We've got patients out there that need us, so you just got to step up and make sure you do your best. And just the rest, I guess, just leave it in God's hands and see what happens.
You guys definitely are the heroes going on. I know we've seen like the hearts for healthcare workers going up on mailboxes and doors. So thank you for all that you guys are doing for everyone in our community. It really does mean a lot.
Thank you.
Thank you. We appreciate that.
Of course. Our next question from Krista Civic. Can someone who has recovered still spread COVID-19? And can those tests determine if you had it and recovered?
The answer is yes. Recovery time can vary anywhere from 5, 7, 10 days, sometimes even 14. But we are seeing patients who feel much better, almost asymptomatic, and then when they retest, they're still testing positive. There's still a viral load there that is detectable by those tests. So yes, they can still shed the virus.
Okay. Dr. Bassar, do you have anything to add?
That's correct. What Will said was totally correct. You can still shed the virus. We do determine, we do say that there should be a quarantine period of 14 days. That's 2 weeks. Some studies have shown that there could be viral shedding even going on up to as much as 37 days, which is kind of concerning. We've heard these reports before, but there's nothing really concrete. For now, what we do know is that somebody that does have the virus should kind of self-quarantine for at least 14 days, prevent infecting anybody else.
Okay. How long is someone that has COVID-19 and is asymptomatic dangerous or contagious? If someone has recovered from the virus, can they get it again, like some get the flu, or are they immune? And that came in from Taria Coughlin.
Well, we're seeing those cases in China, actually. There was recently a publishing from China where people who fully recovered, people who were infected, fully recovered, their assays, their PCR assays, the way that we detect the virus on the blood, it was all negative, non-detected after they were infected. And a couple of weeks later, they once again presented with symptoms, not as bad as they were, but still some viral-like symptoms, like flu-like symptoms, and they ended up testing again positive. Now, whether or not that's another variant of the virus or a reactivation of the virus itself that to some extent was dormant, or the viral load decreased to the point that it was not detected, we still don't know. And this is the humbling part about this whole thing with this virus, is that we don't know a whole lot. We're learning every day. And the information that I'm conveying today may be false tomorrow, just because it's such a fluid environment. And again, it's good because every day we're obtaining more and more data. But it's disconcerting for people because it's to some point you're hearing something now, and then tomorrow you will hear another doctor saying something completely opposite. So who's telling the truth? And the truth to that statement is that we both are. It's just that this is changing so much every day.
Okay. Dr. Bassar, anything you'd like to add?
I mean, Will is absolutely correct. I mean, we're getting new data every day on this. We're getting new studies every day on this. The problem is that, you see, this is a new virus and we have very limited information on it. We go by evidence-based medicine now, and we go by publications, and there's so few publications on this. There's so few treatments, investigations that have done for this, including how long it lasts on surfaces, how long it lasts in the air. Whether somebody can get reinfected, that's something very different. We have had reports from China that people are getting reinfected with it. Um, so this is maybe a possibility. The general premise is that if somebody gets the virus once, which can happen, which is the norm, if somebody gets the virus once, you get antibodies towards it. And these antibodies help to fight the virus, and you're generally considered to be immune. But then with some of these viruses, like the virus we're dealing with right now, the COVID, it could be that, hey, you could get the antibody and this virus could mutate and you could be reinfected. So there's a lot of possibilities around that. We are hoping, though, that once you get antibodies, you're actually immune, so we can use those antibodies in the future to kind of treat people that actually have the COVID-19. So that's what we're hoping for.
Okay, and you started to
Right.
touch on it a little bit, but we did have a user, Javier Gonzalez. Thank you for submitting a question. He's asking, how long can the virus stay alive not in a host, for example, on a surface or a package?
I think it varies depending on the surface. And Doc, you can correct me if I'm wrong. Thing is, if plastic, it can last anywhere from 2 to 3 days. Cardboards, I think, is up to 48 hours. Doc, if you want to add on that.
Yeah, I mean, it varies. Honestly, we've been hearing different studies on this, like how long it lasts on the surface, like with the cardboard, the plastic, the stainless steel. It's all varies in the number of hours. There's nothing that's fixed, though. That's what we need to remember. If we're going to be safe, just make sure you desanitize whatever you're handling. I think that's the point at the end of the day. The good news is that even though the viral load on these surfaces decreases over time, so that's something positive. So even if you get a package from, let's say, China, or you get a package from somewhere else, I feel like the viral load at that point would be very negligible. But still, of course, the main point would be that, hey, look, be safe, be pretty cautious, make sure you sanitize everything, make sure you wipe it down before you open it, and that kind of thing.
I mean, you're not being. People ask me this question so often. Am I exaggerating so much? Because again, this is a package coming from Australia, from China. At this stage, you're not. I'd rather have you exaggerating a bit instead of letting your guard down and then get infected. So, what the doctor said, the desanitizing is always a good option.
Okay, and for those who are just joining us, this is our medical roundtable with our 2 local doctors. If you guys have any questions related to COVID-19 that you would like to ask the doctors on our panel, please submit them on this feed, or you can go to our portal at nona.link/portal. So our next question is, does the use of a neti pot help, hurt, or neither? And that's from Natalia Foote. So Dr. Bhavsar, how about you touch on this first?
Let's see, the neti pot. Now, I know that can be used with sinuses, sinus infections. I don't think there's any data on this. I'm not sure will it be really helpful or not. Besides maybe some symptomatic relief, perhaps. Will it help to prevent getting it? I'm not sure. There's no data on it at all.
Well, my only concern with that is the aerosol, the particles that can be shed during the neti pot, right? We're not, people who have asthma usually either use the pump, portable pump that they can carry in their pockets and they just puff, or they can get this machine to get the solution there and get this breathing treatment. And whoever has seen that before, you see that there's a lot of like vapor-like solution that comes out. And we're telling our patients to instead go through the pump, the one that you carry in your pocket, because if you have the virus, then you can spread the virus that way if you use the machine otherwise. So that would be my only concern. But you're right, Doc. I haven't read anything on it.
Okay, interesting. What are the best foods and supplements to boost immunity? And that came in from Paula Roman. Dr. Felix?
Anything containing vitamin D. Vitamin D and vitamin C. I'm sorry, vitamin C. It's always good. A great antioxidant. I think our community is a very healthy community. If we haven't noticed, this is a community that embraces health, embraces being fit, staying in shape. If you see around us, we have people embrace the healthy eating. And I think a nice balanced daily intake of carbs, proteins should suffice, along with your daily portions of fruit, vegetables, and so on. And again, a multivitamin will not hurt at all. So I don't think we have to now suddenly go out and try to mix a magic potion to just get the immune system up. First of all, I don't want anyone to go out there and be exposed. Stay home. So I think a healthy, balanced diet should suffice if you're healthy otherwise.
Okay. Dr. Professor, anything else?
Yeah, I mean, totally on point. I mean, exercise, eat healthy. Look, there's no magic supplements out there, honestly. If you're taking a multivitamin, keep doing it. I mean, taking vitamin C, keep doing it. You're taking zinc. There's some studies out there that zinc may be beneficial. You look at your multivitamin bottle, you can look with this zinc inside there. That's fantastic. Turmeric capsules, which you can order online and get right delivered to your door. That's another plus. But vitamin C, turmeric, zinc, and like what Dr. Felix was saying is that, hey, if you exercise, you make sure that you are keeping healthy, you're eating the right foods, just trying to just make sure your immune system is strong by doing all these things like yoga, cardiovascular exercises, and just avoiding alcohol, avoiding smoking, especially if you're a smoker, please quit right away.
Oh yeah,
This is something that affects your lungs. So if you're a smoker, I advise you just quit right away. Your lungs will recover very quickly the moment you stop smoking. So I think that's an important piece of advice that should be put out there.
And I don't know if you guys can see Melissa Stewart Salomon. She just said goes take her vitamins as soon as you guys said
thumbs up.
vitamins. So our next question, are NSAIDs, I hope I'm saying that correctly, dangerous to use for COVID-19 symptoms? And that came from Lisa Doyle.
Doc, go ahead.
All right. So, okay, for NSAIDs, there is some studies from Italy and France that show that they increase the penetration, the viral entry into the human cells, and actually increase the viral replication. Now, there's nothing that's published yet on this, but there is a couple of things that are coming from France and Italy regarding this. So we're trying to avoid any NSAID use at this point. We're talking about ibuprofen, Aleve. What we think is safe right now is Tylenol. It's metabolized in the liver, and as long as you don't have any liver issues, Tylenol should be safe for fever or body aches or anything else that you might be feeling.
I concur with that. The literature from France is very disturbing with the concomitant use of NSAIDs and the potential for a complicated infection once the patient has had COVID. So I'm doing the same thing in my sports practice. I rely a lot on short-term NSAIDs, and I'm not doing that anymore, right? I'm not going to wait. If there's something suspicious at this point, because we don't know a whole lot, I would rather embrace what our colleagues who are going through this first than us. I take their feedback very seriously. So in my personal practice, I'm no longer prescribing NSAIDs.
Okay. I see a lot of people buying and selling household items in the neighborhood. What advice would you give them? And that came from Karen Stutler.
How like what, for example?
Maybe they have an excess of Lysol wipes or toilet paper, all the stuff,
okay.
hand sanitizer.
Okay. Listen, if you ask me if I want toilet paper, the answer will be yes. Now, if they're properly packaged, I'll buy them. I'll take them, for example. Now, something that's been open, something that has been exposed, I would have my reservation, especially when it's our intimate items, such as toilet paper, just to mention something. I guess so. But if it's a disinfectant, of course, they're running low on the supermarket. So I think that's okay. I guess it all depends on what specifically has been sold.
Okay. Dr. Professor?
I mean, correct. It's just like, if it's unopened packages of disinfectant wipes, or if it's like toilet paper. Hey, I don't know why that's short, by the way. I'm not understanding that. So somebody needs to explain that to me. But if
right.
It's not opened,
there's a profit.
And it's not used. Then okay, then you might consider taking it. But what I've seen is that a lot of people they got like items like saying, okay, we don't need these toys, we don't need this right now. I mean, that's great, but you have to be careful. Like what I said, you have to be careful when you're like picking up these items. Let them leave them outside. If you really need it, that's fine. Just make sure they leave it outside the garage. Make sure when you pick it up, you handle it very carefully. You wipe it down before you put it in your car. Or you take it back home, you wipe it down again, and then bring it inside the house. Following maximum precautions. I won't say don't do it, but I'm saying this might not be the time to do it. But if you need to do it, then just be precautious in doing it. Okay.
I agree.
Okay. And then we have Jenny Lynn. Is there anything we should know if we suffer bad seasonal allergies? So we know this is hitting at probably no worse other time. Everyone's sneezing from the pollen count. So what can we do?
Well, first of all, if you're sneezing, if you're coughing, and you're not feeling quite well, I don't know if it's safe to say this, but do not assume that this is just your regular allergies. And this is why. It's not the same to cough in front of someone nowadays and say, this is just the allergies. There's a sense of security there, and then you can go on with your life. But because this virus, it's so novel, it's so new, it's so peculiar, we don't know a whole lot. The spectrum of presentation can vary so much. I'm telling you, there are people who present just with diarrhea. They don't have a fever. They don't have the cough. They don't have the chest pressure. They just show up with diarrhea, right? So, and there are people who just don't present any symptoms whatsoever. And that's what's troubling about this virus, is that someone may present very mildly. And because we're in the season, because we're in Florida, we may think, okay, this is just my allergies. I'm going to just go to Publix and I'm going to buy whatever I'm going to buy. And then you sneeze there and, oh, don't worry, it's my allergies. We don't know. So I think at this stage we have to err on the safe side, because that question has been brought up to me multiple times. But I think it's the allergies. I'm like, I don't know. Can you attest to that is truly the allergies nowadays?
Right.
And this day and age, I would err on the safe side.
Okay. Dr. Bafsar, anything to add on that?
I mean, exactly. You got to be it's kind of difficult in this time. Like, if you got these allergy symptoms, and you're having the runny nose, you're having a cough or anything like that. If you notice anything a little bit different, like you're having more shortness of breath, or suddenly having a bit of a sore throat, which is unusual for someone with allergies, then definitely be a little bit more alert and aware. I think that's what we're trying to get the point across. We have to be more alert. We have to be more aware that this could potentially be something else. We don't want everybody to go out in there and panic, obviously, but we want you just to be more cautious when you have these symptoms and say, okay, is this a typical allergy symptom to me? Have I had this, but does it feel a little bit different? Feels a little bit different? Please, take it seriously. So I'm trying to say, don't panic about it, but take it seriously.
I mean, if in doubt, call your doctor. Listen, we are so available right now. Telemedicine is exploding as a safe platform to treat our patients and to answer all those questions. And when in doubt, call your doctor. Listen, I think I have the allergies. And guess what? The doctor may actually inquire into some other symptoms that you may not realize because you're overlooking at it.
Exactly.
But we're more in tune with the current literature that's out there, especially for this virus. So we may ask you some questions that may lead to a different path. So when in doubt, call your doctor.
Okay. And then Aaron Mason Paredes, I hope I pronounced your last name correctly. I apologize if it did not.
Hey, Aaron.
Just submitted. I have two questions. One, is there any evidence that mosquitoes carry this virus? So we'll let you guys touch on that before I go into the second one. Dr. Bassar?
So as far as right now, no, there's no such evidence that mosquitoes can transmit this. This is human to human transmission. It's called a zoonotic disease, basically. So basically it originated in animals and it was transferred to humans. And it's a human to human transmission that's happening right now. Humans, a zoonotic virus basically means animals to humans, but not really humans to animals. So, but it can't go human to human, but it originated in animals. So this is not mosquito-borne or mosquito-related at all.
Okay. And the second question was CDC recommendation of 6 feet. Is that accurate?
it is fairly accurate, and there's a rhyme and reason for that recommendation. It's because the weight of the typical droplet that comes out of our noses or mouth when we speak, or I mean, in some instances when we sneeze, by gravity, those droplets should be as a projectile move forward, and eventually, as a pendulum, they will go down. So the average distance for that to happen is roughly 6 weeks. But now that's not taking into account, if the theory is right, that these particles could just remain airborne for several hours. So it's a good start. The 6 feet absolutely is a good start to maintain that social distancing.
Okay. Aaron McCook Wexler, we are likely all opting to wear some form of mask if going to stores. What is the risk of virus entering through the eyes? Other than not touching your eyes and face, what precautions can we take if this is the case? Dr. Felix?
There's a possibility. It's a wet surface in our body. It's technically mucosa. So there's a possibility. That's when we are in the emergency department and we're dealing with a person who we suspect may have COVID. Among the gear that we wear are either goggles or a face shield, just because we know those droplets transmitting the virus can go anywhere, either the mouth, the nose, and the eyes. So yes, the eyes is a pathway. So absolutely. And I'm going to take this question, and it's a great question, Aaron, because we're debating whether or not all citizens should wear a mask. So, and again, maybe I'm touching a topic that I should not right now, but this is my concern with the mask. I think there's great potential to reduce the spread. But first of all, we have to make sure that that mask properly fits you, right? Not all masks fit. It's not like it fits all at the same rate. No, there's different sizes of masks. There are different qualities of the mask. Now, let's say it fits you and you know how to use it. It defeats the purpose if you're continuously doing this just to recontour the mask or make sure that it's properly placed, because now you're touching your face with your potentially contaminated hands. So it's not just wearing a mask. I don't want the population, our community now, saying, well, I'm going to get a mask. It means that I can go out. It means that I don't have to practice the social distancing. It means that I don't need to stay home just because I have a mask. It's a protective gear as long as you know how to use it. But the best defense right now, Aaron, is for you to stay home.
Thank you. Dr. Bofsar, anything, did you want to touch on that at all?
No, not at all. I mean, like, you hit the point of the nail on the head. I mean, you stay home and, just like I said, you could use a mask, but the improper use is so high, and you need to have a fit test done, which you get done in the hospital to make sure nothing else is entering around the corners of the mask when you put it on, and then make sure it's the right size. Not every mask is going to be fitting you well. It may not offer you any protection at all in that case, so you just have to be a little bit careful when you're getting masks and you're trying to use them and everything else. And like we said, right now, social distancing is probably the best preventive measure that we have.
So to go off of that, Erica Larios Grimaldi, she asked, all over social media, I see recommendations to use homemade masks. Is that safe?
Doc, go ahead.
Wow. So, social media is one thing. And then we're hearing some recommendations from like even the CDC talking about bandanas and homemade masks.
I did see that.
Yeah, it kind of puts it down in your mind, right? Like, what are they talking about? Does it even make sense? Well, the way I put it is that, look, if this is a last resort and you need to use a mask and you are sick yourself, then please go ahead and get that mask. If it's a homemade mask, if it's a scarf and you want to use it, that's totally up to you. There's absolutely no data that homemade masks are effective. It's really difficult to say, because somebody could make a homemade mask out of a different substance or a different material, and somebody else could make it out of the right material. It's so hard to weigh this. So
right.
I feel like some of these things just be taken with a pinch of salt.
Right.
Honestly, I would say, is it safe? Think about it. Probably not.
So that actually
yeah.
leads into our next question, which was, instead of throwing masks away, why aren't they simply sterilizing them with UV and/or ozone? And that came from Logan Rose.
It's easier said than done. There's a technique. There are techniques. Actually, the Duke University has been practicing this for a while. They use hydrogen peroxide, and almost in a vacuum environment, almost like a vacuum autoclave environment, using specific concentrations of hydrogen peroxide. But it's not. There's a special path to do this, and to do it safely and to do it efficiently. So number one, you're truly achieving cleaning the mass and getting rid of all debris and viruses. And number two, not to affect the integrity of the mask. So ideally, what we need to do is we use a mask just one time, especially the disposable ones. Now, because of the shortage that we have, we're telling healthcare providers to use them until they're soiled. And I laugh because the doc was right. The CDC even recommends, one time I think they said it, just tell the healthcare providers to wear bandanas, and that's ridiculous. It may filter dust, but it will not filter out a virus that is so tiny that will easily penetrate. I guess I can see the value for people who are actively coughing as a barrier to stop those droplets. But so I can see the value there as a last resource, but it does not defeat the best tool, which is to stay home.
Well
I,
said.
I'm going to say that a lot of times. Stay home. Stay home.
Joanna Armet Walling, she said, my husband is still working. What should he be doing when he comes home? For those of us that are the essential workers.
Go ahead, Doc.
Well, I'm just wondering what kind of like work he's doing. That's one thing. Whether he's in the healthcare profession, or is he is he with somebody that works in grocery stores or some other essential service? So it really varies. But I mean, like, you have to be very careful. Like, depending on your clothes, depending on what you're touching, make sure that before you go walk into your home, your shoes, you're making sanitize your hands with hand sanitizer if you have one, or washing your hands before you walk into the house. Keep your stuff in the garage, depending on what kind of field you're in. Just try to avoid bringing anything into the home that could be contaminated. I would put it that way.
Yeah, I do the same. And again, maybe it's I'm going to get a bit personal here. I almost stripped almost naked in the garage. I stripped down to my underwear. I have a plastic bag that I put all my clothing. Obviously I closed the garage door. I disinfect everything, the shoes, especially the shoes, the soles of the shoes. I have hand sanitizers. I have detergent that actually desanitizes too, and I spread that all over the car before I go in. I do not haven't touched my family in a while, so I quickly go upstairs and take a shower, and I probably take 2 or 3 showers at the same time just to make sure that I get rid of everything.
Right.
I don't know about you, Doc, but that's and sometimes I feel like I'm not doing enough.
Right, and it's like I said, the anxiety thing comes back in. Like, am I bringing anything into the house? Like, you would take your maximum precautions, take your stuff outside in the garage, go upstairs, make sure you shower right away, don't contaminate anything around you. There's always that fear that I'm bringing something into the house, but just, you got to do your best the way you can do it, and that's it. Like, just leave everything in the garage, go upstairs, shower right away before you touch your family or before you walk into the kitchen or anything else. Just make sure you're clean, wash your hair, because this has been shown droplets can be on hair as well. So it's very important that you wash your hair as well if you're going to want to shower every day. And we're actually recommending that you wash your hair every day, especially for healthcare workers right now.
Yes.
And Joanna did respond. She said that her husband is a store manager. So I don't know if that'll help you guys pinpoint your answer a little bit better.
Well, yeah, he's exposed. I'm assuming that he takes
Right.
care directly of clients, and actually, these are the unsung heroes, and because we're focusing a lot on healthcare and that healthcare providers, and that's fair, because there's a need. Um, but how about the unsung heroes? How about the employee at the supermarket, the employee at the gas station? I bet you almost none of them are wearing protective gear. right? And they're still serving, they're still providing. So to some extent, they're even more exposed, especially to those who are not presenting symptoms.
Right.
Which are the ones, that's the patient that I got exposed. I was exposed not by a patient in the emergency department. I was exposed by a patient who I saw in my sports medicine practice that did not meet the criteria, didn't have a fever, did not travel abroad. Back then, we were still asking those questions. So there was no reason for him to wear this mask or for us to be on guard. Uh, 7 days later, he tested positive. So I was contacted by the Department of Health. So I was not wearing any protective gear because he did not meet that requirement. That guy was perfectly fine. Vital
Right.
signs were great. So that's the scary part. That's where people, that store managers, personnel that works in the stores and the supermarkets, they're getting exposed to. And so they are in the same line of fire as we are.
And Erica Larios Grimaldi, she said, as a veteran who has served in war, thank you all for serving us on this war. Please stay safe and God bless you and your families.
Thank you.
Thank you very much.
So I'm hearing a lot about chewing ginger or drinking dandelion tea or apple cider vinegar prevents the virus from moving to your lungs. Is any of it true? And that came in from Jeanette Roca.
Anecdotal. Just because it sounds right, it doesn't mean it's right. That's the difference between myth, and that's the difference between myth and science. It's Doctor, I haven't read any literature about it, and the fact that people are posting this and attesting like this is such a fact, it's really concerning.
Right. It's like we say, there's no papers on this, no evidence that this actually helps the virus from moving into the lungs. I mean, maybe the chewing ginger part will help you maybe with your immune system in a way. Maybe if this is what you're doing every day, then don't stop doing it. That's great. Maybe, if you're drinking the dandelion tea and you think it's working for you, it helps you, that's great. Whether there's any evidence about this virus from moving into your lungs, preventing the virus from moving into your lungs, unlikely.
Okay.
Right. I agree.
And Brian Hunt, when it comes to doctor appointments, physical therapy or pain management or any other specialist that people usually have to wait weeks to see, reschedule or keep the appointment during the stay at home order. So are you guys rescheduling those appointments? How does that
Yes. Especially we're using a lot of the telehealth platform where we are able to assess the complaint. You'd be surprised how efficient this platform can be, because you cannot do a thorough examination, but you can have the patient take their vital signs to some extent. In the world of sports medicine, where there's a lot of touching and moving around just to see, it's true it's not a complete physical exam, but you can still have the patient mimic some of the motions that I, as a clinician, tell the patient to do in the clinical setting to see if I'm able to reproduce anything, pain or any signs. The physical therapy topic, it's more hands-on, so I can see the value of actually going to an appointment. But my best recommendation is, if this is a pain that can be managed with analgesics like Tylenol, like the doctor was saying, and can wait a little bit, I would rather have you at home in the safety of your house. I'm always a phone call away. So the doc, so are all the healthcare providers. We can always pick up the phone and talk to you. We can always call in medications that are safe at this stage, instead of having a patient that is otherwise healthy being exposed by going to a clinical setting.
Okay, Dr. Bossar, do you have anything to add on that?
No, totally. I mean, and at this point, I think, we should all be trying to use the telemedicine service, avoid coming into the office for unnecessary reasons. If you're going to, and then at the same time, you've got to stay healthy, right? You've got to make sure you're staying in touch with your doctor. You've got to make sure you're keeping those appointments telemedicine wise. Why I'm saying that is because we don't want you coming into the hospital for something that could have been prevented if you had just gone to refill of your medications, if you'd just been taking care of your high blood pressure, of your diabetes, or anything like that could have been preventable. So definitely
Right.
try to make sure you keep with your doctor telemedicine wise, phone call wise, A lot of the rules have been relaxed. You can even like Zoom with your doctor now. You can Skype with your doctor now.
Oh yeah.
Just making things as easy as possible so you can get that care across without having to
For
come
sure.
to the office, get exposed, and expose the rest of the staff or something like that. We just want to make sure that everybody gets the care that they need so we can prevent any admissions from coming into the hospital, because like we said, like this is getting to a stage where there might be a surge very soon, and we want to make sure we have enough beds for everybody, and whatever is preventable, we want to keep that outside the hospital as much as possible.
Okay, and Joanna Armet Walling, she said, thank you so much. We're so lucky to have you guys in the neighborhood. And for those of you who are just tuning in, this is our medical roundtable Q&A with Dr. Sumit Bhavsar and Dr. Will Felix. So if you guys have any questions, please go ahead and submit them now in our video stream and we will filter through. So our next question is from Luz Knee. What are the best ways to strengthen your immune system to aid prevention while staying home? Dr. Bhavsar?
Yep.
Yeah, I think we kind of like answered this one a bit earlier as well. We talked about good nutrition, staying healthy, exercising, avoiding alcohol, stopping smoking right away, taking whatever supplements, vitamins you are taking, vitamin B, vitamin C, vitamin D, like what Will mentioned. Just trying to stay with those healthy habits. That I think that's the main thing. That'll keep the immune system really strong. Anything else to add? Will?
No, I mean, you're right on target.
Awesome. This next question came in from Brielle Perez. Are there any clinical trials around the area that are implementing the treatment of, I'm probably going to butcher this, azithromycin and hydroxychloroquine to treat COVID-19? And if so, has it been successful?
Yes, there are trials currently undergoing. Actually, I know New York City, they're doing trials. I know Puerto Rico is actually conducting trials. Has it been successful? The preliminary data, it's promising. Now, there are conflicting versions of this. The French love it, right? The Italians have mixed reactions on this. In Spain, they're going more with medications that truly target viruses, the virus itself. So I think it's one of the many drugs that we're looking into as potential treatment options as we hopefully get to a vaccine, as we hopefully get to a medication that is proven successful to treat this and in a safe manner.
Okay.
Right. So, for any trial, when we're implementing trials, these do take some time. This is a very new virus, so what we say, what we're relying on is experimental data at this point, where we're using medications like remdesivir, we're using medications like azithromycin, hydroxychloroquine, that's what's mentioned over here, combinations of those, and trying to see if this is effective or not. There are mixed reviews on it, like what we'll say, there are mixed reviews from different countries about it. The problem with this combination is that although it's beneficial, it can also lead to heart arrhythmias, which are very common with this combination. And I think this is where a big drawback has been. The hydroxychloroquine is basically now, the hydroxychloroquine is actually an immunosuppressant. And, this is why a lot of people have been trying to take this prophylactically and taking it for preventive reasons. And I would say don't do it. Start bringing off the question a bit, but I've heard this. Don't take it unless you're actually in the hospital and you're actually sick, and the doctor at that point says, let's use this combination to kind of treat you. Don't treat yourself at home with this.
Right.
There's some data out there. We need to keep you on EKG monitoring. We need to keep you on telemetry. We need to see what's going on with the heart. Because I've seen telemetry strips yesterday that showed a patient who had all these prolonged QRS, which basically means the heartbeat was going to land up in arrhythmia. So it's kind of a subject where there's not enough data right now, and whatever experimental therapy that we can kind of use at this point, because we don't have a lot against this virus. We have maybe 3 drugs, like what we mentioned: the remdesivir, we have the hydroxychloroquine, and we have the azithromycin. That's all we have right now, and we will use them, but only in certain patients where we think they're going to be effective. Please don't use that at home, and please don't hold these.
So basically, stick to what you're prescribed.
Exactly.
Absolutely.
Okay. Our next question is from Jessica Adams. For live-in facilities, do you think best practice is for patients to stay in their rooms rather than congregating to eat, watch TV, etc.?
Absolutely. Absolutely.
Say no more.
No
Say
doubt.
no more. Absolutely. Yes.
Like we mentioned, it's an asymptomatic spread also. I could be showing no symptoms on day 1, and on day 7, suddenly I have all these symptoms, and I've already infected everybody around me. So this is, this is what the problem is. So definitely, and even if you feel well, yeah, just stay in your room and eat your lunch.
Yeah.
This will pass.
Absolutely.
And Brielle Perez said, such good info. Thank you for all your time.
Thank you.
Thank you.
Paula Roman, thank you for speaking with us today. That's what she just said. So seriously, thank you guys. We do really appreciate having you on here. Another question is from Michael DeMarco. What are the trade-offs of herd immunity versus social distancing without the availability of a vaccine?
Well, I think he's referring to a report, not a report, actually, an article in a newspaper advocating that why don't we just all get exposed so we can finally get all that immunity and we can get this over with. Well, it doesn't work that way. It's not that simple. The herd immunity is achieved when, first of all, you know more about the pathogen that you're dealing with. When there are potential treatment options that have been proven over and over to fight it. Like for the flu, we have Tamiflu, right? Um, and under very controlled environments, controlled settings. This is by no means a controlled environment. This is by no means a control setting. We don't know a whole lot about this virus. So under those circumstances, this is not the best way to conduct an experiment on live specimens, on human beings. Until we get more data, until we get more knowledge, uh, the best thing to do is not to go gun ho on this and just get exposed so I can finally get it over with. Because you know what? This is no longer a disease that is attacking the immunosuppressed and the elderly, right? So there are people who are young, people who are healthy, and they are succumbing to this disease. They're dying.
Mm-hmm.
So so who knows how this virus is going to act on each individual. So we don't know that yet. So why take the risk? Why take the chance?
Stay home.
Yes, stay home.
And then, sorry, go ahead.
No, I mean, I agree with him. I mean, it's like you don't want to unnecessarily get exposed. Remember, this mortality of this is, people are like, what is the difference between this and the flu? I could just go get exposed. Even if you're young and healthy, I wouldn't advise that at all. Number one, because the mortality is at least 20 times greater for the COVID versus the flu. So if you get it, there's a 20 times higher chance you may die from it.
Right.
Even if you have a perfect immune system. I've seen 29-year-olds in the hospital that have been on an incubator, like they've been intubated and they've been ventilated right now. And it's sad, and they had no other past medical history of any sort. So we just don't know what we're dealing with right now. So until a vaccine comes out that's been proven to be effective, we have to take this with extreme caution.
Okay. Then from Jody Bradshaw, we
Absolutely.
have, I just heard they may believe this is airborne. Is that possible?
We're talking about this just prior to going live. So Doc, I will lead the way here.
All right. Wow. So, there's a lot of discrepancy around this, right? You're seeing a lot of recommendations, a lot of data that keeps coming out that this is by droplet, and this is not airborne. Then they're saying it could be airborne. So it keeps changing, right, as they keep discovering things. Some of the guidelines don't even make sense sometimes. I would say that there's a possibility that this is airborne, because remember the first SARS coronavirus 1, that's what we saw 10 years ago or so. And what we're seeing now is SARS coronavirus 2. This is all called COVID-2, SARS-CoV-2. If you look at SARS-CoV-1, you look at the structure of the viruses and how similar they are to each other. there is a lot of similarity, and they determined that did have some airborne potential to it. This is why they were recommending the N95 masks at some point. Now, this could be very possible for SARS-CoV-2 because they're dealing with the same family of viruses. So I would say this is highly likely, but until we get some solid evidence on it, we can't say for sure.
Okay.
And once again, touching on that topic, the fact that it's potentially airborne, brings me back again to the topic of the masks. So then I should wear a bandana. There I should wear a mask. I guess it's better than nothing. But once again, the safest thing to do is not the mask. It's not the N95. It's to stay home. I said I was going to say this over and over again. So
Drill that point home.
there you go.
And Jeanette Negron, she said, scary not knowing if I'm bringing something home with me after my shifts. I'm an RN. I take every precaution at work and when I come home, and I still worry. And so I know that's something that you two were touching on that you can definitely relate to as well.
Jeanette, I feel you. I know you. I feel you. I'm scared too. This is a humbling experience. With all the knowledge that we have in the 21st century, this virus has brought us to our knees. Because first of all, we don't know a whole lot, and we are scared. And I'm not afraid to say this. I'm a doctor. I'm a 42-year-old guy, and I'm really scared. In the ER, I've seen horrible things. And even though there's a sense of respect for every pathology that comes, especially the one that's severe, this is the first time that I'm scared. I'm scared for myself. I don't want to get sick. I want to see my children grow up. But I'm scared about my family. And we keep bringing this over and over again. The doc just mentioned this before. I don't want to give this to my children. I don't want to give this to my wife. But still, there's an obligation, and I know you, Jeanette, as an RN, there's an obligation that goes beyond a job description. This is a commitment that we healthcare providers do when we sign off for this. So, yes, there are times in which I just want to stay home, but that's not right. So I stay home and I stay in this cocoon. I will not be able to sleep at night. It's about doing what's right, but in that process, as scary as it can be, try to make it as safe as possible. So, as a community, we need to advocate for those who are in the front line. We're talking. I'm going to run out of the topic here, but it's really crucial. PPEs, personal protective equipment. We need that. We need that in our hospitals. We need that for our healthcare providers. So precisely, people like Jeanette, people like the doc, people like I can feel to some extent some peace that we are being protected, even though we're getting exposed. Because we have families, we have friends, and we definitely don't want to keep spreading this. And I'm not afraid to say it. I want to make it out of this alive.
At the same time, we're all anxious about it, but let's do the right thing. Let's do our best when we're doing it. When you're walking to see a patient, make sure you have the right protective gear on. You're washing your hands even after you get out of the patient room. You're desanitizing everything. You're taking off your gloves properly. You're taking off your mask properly. If you have to reuse them, that's understandable. Make sure you're putting them on without infecting yourself again. Be as precautious as possible. That's the best you can do. When you're coming home, do exactly what Will does. Take your stuff off in the garage before you walk in the house. Go run in the shower. This virus is killed by soap, which is amazing. So we can, we use all those things to make sure that we prevent this. We prevent anything from happening to our families. We use all these measures and these steps, and we just do our best with them. And at the end of the day, we're all in this together. And I feel like if that they should be. I think there's also something on Doxy right now on telemedicine that for healthcare professionals, that if you want to reach out and speak to somebody about it, if you feel like you need an outlet, if you want to talk to people about it, they're on mental health therapists, and that they can help us get through this stressful situation. Because I feel like sometimes as healthcare professionals, when you're in this environment, you don't have an outlet, you don't have anybody to reach out to. I mean, you can always reach out to one of us. That's a given. Anytime, you can reach out to one of us. Anybody needs anything, we're here for you. But there's also other options. There's a telemedicine option. There's Doxy. There's a Talkspace. There's stuff like that to get those emotions out. And trust me, we're all in this together, and we're going to get through this together. And that's a point I want to hammer home. And we're going to be fine.
Thank you. All right. And so we have Marina Olinik. I'm sorry if I mispronounced her last name. She's wondering, what can we do to help medical professionals?
Stay home. Marina, stay home.
I love it. Well, he's like, yeah, stay home, guys. Stay home.
Simple. Stay home.
I agree with that 100%.
Yeah, stay home. You're not going to get infected, or the chances are very low that you will get infected. Number two, if by an unfortunate event you have the viruses and you don't manifest the symptoms right away, or you're one of the lucky ones who has the virus and has no symptoms, guess what? By staying home, you're not infecting others who can potentially get really ill from this. So the best way to honor Doc, the best way to honor me, the best way to honor those who are putting their lives on the line for the better purpose is to stay home.
And to kind of play off of that, I did have a question, and I know it's besides staying home, is there anything else that we can do to help you guys out? I know I've seen a lot about groups, maybe joining and sewing masks that are supposed to help for the shortage. What can we do to help you guys besides staying home?
Go ahead, Doc.
Well, definitely maybe a drive to see if anybody has any PPE, protective equipment that they spare, and donate to the local facility, to the local hospital, and say, hey, I have these N95 masks I'm not using. Would they be useful in the hospital? Just contact your local hospital representative and say, hey, can I donate these masks so we can do it the right way? Definitely, I think every hospital is short right now, and we could all really use that. Second, advocacy. Pushing out, telling your local senators or whoever it is, maybe your local mayor, to say, hey, we have this hospital and our doctors are short of this equipment. Mm-hmm. How can we help them? Can we get them what they need? And I think if we get a big drive from the community, like an outpouring support from the community, some of the seriousness can be translated across to say, hey, this is the situation, this is what's happening. How can we leverage, our local senators, our local mayors to kind of step in and say, hey, okay, let's do something about this. I think if anything, maybe shooting an email or something like that, it may help. I'm not saying it's necessarily going to help, but it may help. But do it from home, like what Will said.
No, I'm going to share this brief story. The other day I went to my ER shift, and I saw a nurse who was crying on a corner. And so I approached, like, is everything okay? And she said, well, this is kind of embarrassing. I'm like, what's going on? Well, she was working her fourth 12-hour shift in a row. So there's virtually no time. Those 12-hour shifts can sometimes turn into 13, 14-hour shifts. And what little is left is to proceed with what's left of a normal life, trying to go to the supermarket, and do groceries and take care of a family. Well, guess what? Many people hoarded on toilet paper. And she had no toilet paper at her house. So it was almost embarrassing, but it struck a chord because that's the reality. We're also human beings. And we're there for you. So you're talking about donation. Yeah, we're talking PPEs. Yeah, donate PPEs. Donate the mask if you are not overly exposed and you don't need it. Go ahead and do so. But you know what? There are items that we as human beings need. We need toilet paper. We need disinfectants. We need detergents. And because by the time we go to the supermarkets, they're already gone. We don't get to go to the in those prime hours where, let's say, in the Sam's, they usually are there on Wednesday mornings. So whoever goes there on a Wednesday at 9 a.m., they are favored because there will be stuff for them. That's not the case for many of us healthcare providers. So I feel for that nurse. So be considerate.
Okay. And we had a few comments rolling across the screen. So Paula Roman, there seems to be so many different symptoms. What are the most common ones?
Go ahead, Doc.
Well, you're gonna get the most common symptoms. It's gonna be like upper respiratory symptoms. You're gonna have the dry cough, sore throat, the fevers, occasional on and off runny nose, and possible shortness of breath. Those are the most common ones that you could see. And I think the one that you really have to be worried about is the shortness of breath. When you start feeling that, then that's a time that you should come into the ER right away. You feel like you're having difficulty breathing, please don't hesitate. Come into the
Mhm.
ER, because we've seen rapid progression of cases where
Oh, yes.
you start with a dry cough, like what we're saying, you could start with dry cough, you could start with let's having a fever and a sore throat, but you get a little bit of shortness of breath in the morning, and by the evening, you might need to be intubated. That's how
Yes.
fast this thing can progress. So you
Yeah.
feel a little shortness of breath, even if it's nothing, it's fine. Just come to the ER and let us know so we can
Yeah.
take care of you.
Yeah, that's very true. There are people come to the ER with low sats, but they're still talking. They still are able to maintain a conversation in phrases. And 30, 45 minutes later, you are on top of them trying to open up the airway because they crash. So it's a very rapid progression. Now, China just published an interesting data. 80% of the people who were infected in China lost their sense of smell. Interesting. So, yeah, but I agree with everything the doctor said. Those are the most common symptoms. So we have to be very watchful for those.
Right. I saw that also, the anosmia, the loss of smell, loss of taste. It's
Mm-hmm.
difficult to explain. I didn't read much on it though yet.
Mm-hmm.
It's
80%. That's interesting
wow.
because I know there have been some cases here that also manifest, but it's not the sole symptom.
Right.
I had a patient, a veteran, who just presented with a rash, no fever, just a rash. Um, but once again, the common ones that we worry about, as the doctor said, are the shortness of breath, the cough, difficulty breathing is a red flag. So don't try to make up excuses like, oh, this is just my asthma. Well, even worse, go seek help.
Okay. Leah Sardo, she said, it's so frustrating that I'm staying home, but every time I have to get groceries, it's having to start over 7 to 14 days to see if I've caught anything. So sad.
Yeah, it's true. That's our sad reality nowadays. I'm buying everything online, Leah. If that provides any comfort, uh, I don't want to advertise any brands here, but there are multiple options there. So it's not perfect, but it's much safer than obviously being exposed in a place where there's multiple people gathering.
And I think one of those things too that I've seen is, in this type of scenario, it's very difficult to keep a positive mindset. But something was like, instead of feeling like you're stuck at home, think of it, okay, you're staying at home to help save however many other people that could potentially be infected if you were carrying the disease.
That's how you were winning the battle, staying at home.
Stay at home, be a hero. Save
Hmm.
lives. That's what we're saying. And I know it's frustrating. I mean, this is why we're recommending that we don't go out grocery shopping unless it's absolutely necessary, and take care of anybody of your neighbors that might need something. Like if you are going out and you really need to go grocery shopping, and it's just you really have to go there, then just make sure just to check with your neighbors, give them a call and say, do you guys need anything? Just because I think we have to look out for each other at this time. And just make sure that, hey, somebody's elderly, maybe very scared to go into a grocery store at
Yeah,
this point. They might not know how to order online also, so we have to watch out for them also. So if you know any neighbors that are elderly, so watch out for them as well. I mean, we're all looking out for each other, and I think we got each other's backs, and we have to make sure we get through this together.
absolutely.
And on that note, we are going to go ahead and wrap up our first medical roundtable. So thank you so much for joining us as an
Absolutely.
audience, and also to Dr. Sumit Bafsar and Dr. Will Felix. Thank you so much for all that you guys are doing every single day. It really does mean a lot to all of us.
Thank you.
so much. We really appreciate you having us. Thank
Of
you.
course. Thank you to everyone watching, and hopefully we'll be seeing a lot more of this.